It's exactly 19 minutes after 7, and I'd like to say a belated happy birthday to Reverend Franklin Jan of Life Restoration Chapel. The message is, you've been a blessing and inspiration to myself and my family. May God prolong your days to fulfill your mission on earth. And that's coming from a former producer of mine and friend, famous Atichogwe, to you, Reverend Franklin Jan of Life Restoration Chapel. I hope the birthday continues into the weekend. Let's pay attention and join the rest of the world as today marks World Hepatitis Day. The Hepatitis Foundation of Ghana is calling on government to pay a little more attention to the building of treatment centers for the disease. The theme for this year's global campaign is simply elimination. Now, earlier this year, WHO member states at the World Health Assembly adopted the first ever elimination strategy for viral hepatitis. And we will get to know a lot more about what we're doing even in Ghana. This is the first time, though, that the national governments have signed up and committed to the goal of eliminating viral hepatitis. Here in Ghana, we want to find out what activities and strategies are being implemented to ensure the elimination of the disease. And that's why we've been joined by Program Manager, National Viral Hepatitis Control at the Ghana Health Service. Dr. Emmanuel Jochi is joining us. Good morning, Doc.
Good morning.
Also, Theobald Osuansai, President, Hepatitis Foundation of Ghana. Good morning to you as well.
Good morning.
Thanks for coming. Any statistics to share, Doc, on how well or bad we're doing?
Yeah. Well, with what we have implemented, as we call the surveillance system to detect the cases, we have established what we call the surveillance on acute viral hepatitis in the country. So meaning at the end of every month, the facilities report to the district, and the districts report to the region.
Okay.
And this comes into, and then we have a database of which we get those data. So looking at the period from 2009 up to 2015,
okay,
we had an annual trend of reported acute viral hepatitis cases. These are cases that we suspected to be having viral hepatitis. So in 2009, total of 11,216 cases were suspected. And 2012,
okay, because I thought it was between the period 2009 and 2015.
Yeah.
Okay.
Yeah, these are suspected cases.
All
so
right.
I'm just mentioning the years. So that's 2012 is suspected 12,740 cases, out of which 162 died. And then in 2013, 8,865 cases were suspected.
Okay.
And then 100 died. This for the entire country. In 2014, there was an upsurge, increase in cases, but this was due to the fact that those are the time that we established a good data capture system.
Okay.
So it increased the reporting. So that we suspected 51,240 cases.
Wow, that's a lot.
Out of which 108 died.
Okay.
And 2015, we suspected 40,648 cases, and then 61 died. I must say that these are the cases that we say acute viral hepatitis.
Please explain that.
It means that the disease came suddenly. They came with fever, jaundice, and then abdominal pains, for which the clinician, the doctor, suspects that the person may have viral hepatitis, of which they captured.
Okay.
So these are suspected cases.
Why are they still suspected?
Yeah. They are suspected cases because for you to have a good national surveillance system, you need to add a laboratory component of it.
Okay.
The laboratory component means that we do testing for all, but the testings have been done, but it's only when you have the ability to pay for the cost of tests, that is when the test is done on you.
Okay.
So those are some of the challenges. Assuming we have the funding to be able to purchase the reagents, then we could have tested all these people. So one of the key interventions that we are putting in is to get funding support to improve the laboratory confirmation of these cases.
Okay, I'll come to you, Theobald, but before that, let me stay with you, Doc, for a while longer. So these other persons who died of, still suspected, couldn't it have been proven?
Yeah, well, if we have what we call case definitions. When you present with all the clinical signs and you fit into what we have defined as a disease of having viral hepatitis, then you are put in that category.
Okay.
This may be the cause of why you died, because once the person fits the case definition, which is used nationwide, and this was adapted from the World Health Organization, then we think that you have died from this viral hepatitis.
Okay. I'll come back to you on the signs, the symptoms, what we can all do and everything, but let me go to Theobald and ask the foundation, how much work have you been doing?
Okay, thank you for your question. The foundation came in this in 2007, June 2007. And since 2007, because at that time we don't have any NGOs who are campaigning against hepatitis. All the NGOs was HIV, malaria, and TB. So we decided to, okay, let's come out and help people. Because the reason why the foundation came in this is because my family was a victim of the disease.
Okay.
So that pushed me to come on board.
Who exactly in your family had it?
Yeah. My father.
Your father,
yeah,
okay. So how did you get to know? How did the rest of the family know?
Yeah, they did a test, and the test confirmed, because they were dying. 4 people died from the family.
Okay.
So we were suspecting that maybe it is a case or something, because we could see that the same symptoms referred to other persons. So they tell us to go and do the test, and other people, those who have died, shows that they were positive for hepatitis. That's one. So I decided, okay, learn if it's killing people and people are not aware. So why don't you establish NGO to help people? That's why we came. And since 2007, Dr. Tuchi will testify. We have done a lot of work in Ghana here, not only Ghana and also Africa.
So what's your main work? Is it the awareness creation?
Yeah, our main is awareness creation, and also lobby for policy, and also helping the patient to get better access to treatment. Okay.
All right. So, Doc, what kind of signs would I be showing to tell me that I possibly have?
Yeah. I must say that not all the people will show signs. But if the person should show the signs, the key signs are that the person will come with fever, that is increase in the body temperature. And then also the person may show jaundice, that's yellowish coloration of the eyes or even the palm when you look at it. And then if the person passes urine, you can see the urine very deeply colored. And then when the doctor examines, the person may be having pain in the abdomen. That is at the right part of the abdomen where the liver is located. So those are the key cardinal signs. The others may be feeling very tired, may not be able to eat well, and so on. But those 3 things are the key cardinal signs that we used to see. But I must emphasize that about 30 to 50% may not show any sign at all.
Okay.
Especially children.
So what kind of disease is this?
Yeah, viral hepatitis, I might say what we call inflammatory, injury of the liver cells. And this injury can be caused by viruses. And for viral hepatitis, we have the viral hepatitis A, the A virus, B, C, D, and E. So these are the kill viruses that attack the liver and give us the disease which we call the viral hepatitis.
Okay, so you call it viral hepatitis, but in Ghana a lot of us refer to it as hepatitis B. Is it the same?
Hepatitis B is one of the viral hepatitis.
Okay.
You know, I mentioned that we have viral hepatitis A, we have viral hepatitis B. But B has been common because of the fact that it leads to chronicity. It can lead to cirrhosis of the liver, that is injury to the liver, and then can lead to death. Though others can kill, but these ones, because of the fact, so everybody now even call it B, but we know that these are, we have the viral hepatitis A, we have viral hepatitis B, we have viral hepatitis C, D, and then E. But they vary in the way they are transmitted, the way they spread. So if I may go on, let us group it this way.
Okay.
We can group it viral hepatitis A and E, because they have a common mode of transmission.
A and E.
A and E.
Okay.
It's mostly due to the virus is transmitted through contaminated water and food, just like cholera. So you get it through poor sanitation and through contaminated water. The A and E also, they have a vaccine to prevent it. So the key for A and E is that it's through contaminated water and food and through poor sanitation. Now the other group is the B, C, and D. They fall in other group of mode of transmission. They are transmitted through blood. So if you are exposed to contaminated blood, then you get a B, C, D. So their symptoms for all these are the same. And this group B, C, and D is B that we have the vaccine for. The B and D, they move together. So once you are vaccinated against B, they are also protected automatically against the D as well.
Okay.
Yeah. The C that we don't have the vaccine for.
Okay. How about for the A and B? Okay, so B, you've got the vaccination. C, you don't. D goes with.
Goes.
So how about the A and the E?
You also have vaccine for.
Okay.
For it.
So is this something that we give to the children when they go for the regular immunization? Is it part of the process?
For now, we have the B vaccine. The B vaccine has been part of what we call the pentavalent, that is given to all children that are sent to for what we call the weighing, the child welfare clinics. Once you send your child under one to that place, it's part of the vaccination that they are giving to the children.
Is it for life?
It can protect you at least to 20 years and even more.
Okay. All right. So Theobald, what kind of people do you mostly see are infected? Is it more men, women, children, adults?
Okay. Most of the people who have been seeing is the youth, and also the pregnant women too are also testing positive for hepatitis in Ghana here. And as Dr. Dochi said, most of the patients who have developed the chronic are those who got infected when they were child. So they got infected with the disease and they
grew with it.
They become chronic hepatitis. So the youth are more at risk, and the pregnant women are also at risk.
So what do you do? Do you identify the groups and then you visit them, or how does it work on the ground?
Yeah, we identify them because we have professions we are working with. I'm not a health professional. We have some health professionals we are working with. So when they do the test and people are positive, they refer the people to us because of the cancer. We have to cancel them, and also because we need the numbers to negotiate the price, the treatment price for them. Okay. So that we can, because the treatment is very expensive, so we have to negotiate the price on behalf of the patient. So majority of Ghanaians, those who are positive cannot afford the treatment. That's why last year we launched a policy. So I was expecting the government if we can implement the policy, but up to now they have not implemented the policy. when you go there, they will tell you it's funding problem. But majority people are dying.
But what's in the policy?
The policy, they have about 7 steps: the prevention, treatment, capacity building. Let me say, I have only 3 in mind.
Sure.
But the prevention, let's ask the government whether they have done it, because treating the disease is very expensive, but preventing the disease is cost effective. So we have to prevent the disease rather than treating it. But we are not doing that. And most of the country, let me give you an example. Uganda is doing better when it comes to prevention. They are vaccinating the all children, and those who are born to positive mothers, they are also vaccinated. Because we have to wait for, I think, 6 weeks before we go for the hepatitis B vaccine. Within that one, first day you give birth and that 6 months, anything can happen. So we attend the government. Why don't you vaccinate the baby as soon as the?
But you know, the vaccines the children get, the babies, they have to be of a certain weight to be able to, before the body can take some of these vaccines.
Let me give if you are born to positive mothers, as soon as you give birth, you have to vaccinate the child. Otherwise, you can transfer the virus to the child.
Is a baby like that ready to take such vaccine?
Yeah, what we, as you really said, in the policy, the key preventive measures that you put in place, one of them is vaccinating at birth.
Okay.
So meaning if a child is delivered within 24 hours, we should give the B vaccine. This implementation, though we are in a process, it requires you getting the vaccine. Though we have the strategy.
But the B we have.
Yeah, we have the vaccine. But before you can give to that birth, you need to put in certain measures. Every facility, the staff will be oriented, trained, and then pregnant women are all screened. So as they give birth, immediately the vaccines are made available at the delivery centers.
Okay. This BCG that they give to the babies, I think it's fresh babies.
Yes.
Okay.
Yeah.
But this is not anything close to the vaccine, the hepatitis vaccine, the B.
No, we have not introduced the at-birth dose yet.
Okay.
We are in a process.
Are we really in the process, or the policy is just sitting somewhere?
Yes. What we though there are challenges. You see, the key challenge is the funding. We need to.
When you say funding, money to bring in more vaccines or what?
The vaccines are not free. You have to buy them. Yeah, and at-birth dose is supposed to be free. So we need to have negotiation. We'll have WHO, World Health Organization, UNICEF, Gavi. These are organizations that the government start negotiating. Once now we have the policy. We didn't have the policy. So the policy now paves the way that this is what as a country want to do.
But for how long have we had this policy? Theobald, you've been doing a lot of advocacy. How long have we had it?
Yeah, we have it last year. During the World Hepatitis Day, they launched the policy.
Oh, okay.
And up to now, let me come in with the funding issues. We cannot say that there's no funding, so we are not going to do something. We should start from somewhere.
Where do you think we can start from?
We can start because we have other facilities in place. Let me say HIV. HIV is well developed. So why don't government integrate hepatitis treatment or education into the HIV campaigning? Because HIV, they have all the materials, they have database, they have the staff, they have the machine. Because hepatitis and HIV, they use the same machine to run the viral load. Or you have to buy the reagent. And also they treat the medicine are the same. They are using the same medicine. And if you are HIV positive, the dose is free for you. But if you are hepatitis positive, you have to buy it. So the government can integrate it. We don't have to wait for people to die before we start something. We can start from somewhere. Because we don't have to say, we fold your hands, I don't have money. When we all started the foundation, there's no funding for us. But you start from somewhere. When we started doing something, the people will come on board. Because private people want to come on board. to help the government to vaccinate the babies, that's the newborn babies. So we don't have to wait and say we don't have funding, so we are not going to do something. No, we should start. Awareness, you can start from somewhere. You create awareness, people to get to know, and they go for the test. When the test are positive, because do you know why government? I always said, when I was in South Africa, I said it, because hepatitis symptoms prolong before, like when you get the disease, it prolong before it even show that you are positive. But HIV and other disease, the symptom will show within 5 months, let me say 2 days or 3 days. But hepatitis is not like that. So that's why the government is not paying attention to viral hepatitis.
So, Doc, is this vaccine at birth being practiced elsewhere?
Oh, for now, very few countries that I'm aware of.
In Africa?
In Africa, I think maybe South Africa.
In South Africa,
have introduced Uganda. And very few of them have introduced.
Egypt too.
Egypt as well.
So
how do I know? Because the bits that I am not so comfortable with is the fact that you might not even begin to show signs.
Yeah.
Something that would take you to the hospital.
Yeah.
So ideally, what would you recommend? Do I voluntarily go and take the test? How about my children? At what point in time do we do the tests?
Yeah, what we advise is that because some may not show any symptoms, so we say periodic screening. So
what periodic means?
It means that as an individual, you can go and say that I want to know my status. Once
a year.
No, the test once you do it now and you are negative, that doesn't mean that you'll be negative forever, because if you don't improve on the precautions, then you may get reinfection. So once you test now and you are sure that you have maintained yourself, once you are negative, then you are sure that you will be negative.
Okay.
So what we have put in the policy to be doing is that at least once a quarter we organize free screening so that we can pick up those that may be having the disease.
Okay.
But as an individual, you can also opt and go in just to test to know your status.
Is there adult vaccine? If I test and I'm negative, can I take the vaccine?
The vaccine is for children and adults. It's for everybody. So that when you test and you are negative, you go and take the vaccine.
Okay.
But I must be cautious about the vaccine now. You talk about a lot of vaccines in. Ghana, we already have an established, what we call expanded program on immunization, which the government has established. The vaccine has to be managed in a cold chain, meaning that you should not expose the vaccine outside a particular temperature, you see. But what we have noticed is that some people just go and bring the vaccine, some put in their bags, they bring it in the shop, it's put on the counter, but vaccines.
But why is it available that way? Because I thought when it comes to vaccinations, no other person has it apart from
because
the Ministry of Health or something.
Yes, because the privates have, though what they are doing, they want to help, but you have to help in an appropriate way. So what we are saying is that government have a system to bring good vaccine into the country. So private people can support through the existing system, so that we don't compromise the potency of the vaccine.
But who is allowing them?
Yeah.
Who is allowing them?
Well, that's the problem. That's the problem we are facing, because we have the standard board that should check all those things. Because we in the Ghana Ministry of Health, the vaccine that are imported right from the plane is in the fridge. The cold one goes to the airport, picks it, store it in the national cold room, and distributed to the regional cold rooms, and then from regional cold rooms they distributed to the district cold room. So the government has already established this. You understand me? So even if you are a private person, you want to bring in vaccine, let it pass through this, so that we maintain the potency of the vaccine.
Are the private hospitals aware of this? You know.
Yes.
Because I gave birth in a private facility, but we still had the government health workers come to administer these vaccines anytime you go for either the one that you take when the baby is fresh or the subsequent ones that you go to. It's always the government health workers.
Yeah, but for the B, because for some time now we didn't have a policy to direct people what to do. That is why that happened. Now we have the policy. The policy clearly stated that this is what we have to do. Means that even if you want to import a vaccine, you have to pass through the existing system. You understand me? So that we maintain the potency. As I speak now, we have the B vaccine in existence. So we call on everybody, please patronize the well-regulated one through the government system.
So how would you know that? Is it to go to a government facility or ask for the source?
First, what you have to do is to go to the government or private facility that has been registered. You know, before you open any facility, that must be registered. We already do other vaccinations. So B is not a new way of we introduce a vaccine. So the system for which we use for other vaccines, the same system applies for the B2. So that when you visit, be it a private hospital or a district, a government facility which is registered, then we sure that we make the vaccine available for you.
How can I tell that what I'm being given? I'll come to you, Theo. How can I tell that what I'm given has been exposed?
How can you tell? I can talk for the fact that nurses have been trained to maintain the cold chain for every vaccine. You understand me? So if, for example, they come for the vaccine from the cold room at the national level, when they send it to the region, it's also kept in the cold room at the regional level. Before the district hospitals come for it, they also collect it from the regional cold room. So
what I see the health workers carry is not a fridge, but they've got this.
The cold box.
The cold box.
Okay.
The cold box, they keep ice packs in it, frozen ice packs in it. So it has a period. So those nurses have been trained. So we advise that, please, when you visit the facility, let the trained nurse give you the vaccine.
You say that when you visit the facility, let the trained nurse administer. But how? I mean, I've come to the hospital. How would I know that this nurse is not trained or anything? And how can I, the patient, stop the person from going ahead? I'm just trying to know how much rights do I have as a patient to query what is being administered.
Well, in the first place, as the person receiving the vaccine, you should have gone to a registered premises. That's the hospital or the clinic is a registered premises. That's the first thing.
Okay.
You don't go outside, maybe to a pharmacy shop or something. Go to the registered clinic. Okay. So once you are there, those staff that are working there, they are also being registered and trained, and they should have picked the vaccine from a cold box before administering to you. Because as you see, when you go, they don't just keep the vaccine like any other. They always pick it from the fridge before giving it to you. Then when they finish, they put it back. So you receiving the vaccine, you have to observe that they didn't pick the vaccine from the shelf. They pick it either from the cold box that is tightly closed. Then when they finish, those boxes are closed, or from the fridge. Those are the things that you have to observe.
Okay.
So the key thing is that go to a registered premises, clinic, hospital, see that there's a nurse who has been trained, and then he's picking the vaccine from the cold box, not from the shelf.
Okay. Theo, you wanted to come in with something?
Yes, I wanted to come in. Dr. She was saying about the vaccines. I know most of the private hospitals who buy their vaccines from private person, let me say, pharmacy shop. Because most of the vaccine that comes to the country is for individuals, the pharmacists who are importing into the country. So if I go to hospital, like I go to one of private hospital and they give him a vaccine, how can he tell the patient or the person that the vaccine is for Ghana Health Service? Most of the vaccines, they bought it from third party. So how the third party is going to also handle the vaccine is also a problem now. And those people who go around to do the screening and the vaccination are the health professionals, the nurses and the lab technicians. They go around to do the test, and their concentration is only the vaccine, because they want money to vaccinate, screen people and vaccinate them and get their money and go. So there's a lot of issue when it comes to the vaccine side. There's a lot of issues there. So that's why we say the government should take it at its own. Make it, the program is for you. Take it and implement it. So if you leave it, to individuals, that's this is the problem you are going to have. And let me say, the policy, the government policy is sponsored by a private person, and it's very serious. Because
when you say sponsored by a private person, what do you mean?
Yeah, the policy is let me say, the whole policy was supported by a private company. Okay. Yeah, a private company. So if, like, I'm selling this paper and I'm giving you as a government, you want to set a policy on this paper, and I'm supporting the policy, it can influence the policy. So
what else does the company do then? Is this a company that produces some kind of medicine?
They produce hepatitis B drugs and also have diagnostics machines. And
so I see some kind of conflict of interest.
I always said, when we met at WHO meeting, I told WHO, and they agreed with me that no, private person should not support government policies, because the government is your own. You have to take it as your own and do it. Private man can come in. When you have all the policies, you have everything in place, then the private man can come in. But if you are leaving everything to a private man, then it means the private man will control it. That's why hepatitis, now the private people are controlling hepatitis. And I always said, it's a gold mine for most of the private people. They are taking money from people. And when we talk, people will say, oh, this guy, don't mind him, he's talking too much. But we are fighting for the people. I'm not fighting individual. I'm fighting the system. The system you are working. I'm fighting the system.
I get you. Yeah. And I know that Doc is not the right person for me to do a follow-up with. So I'm just going to move on and ask, if the vaccine is exposed, what do I stand any risk? I mean, if I get it, if they administer it on me, I mean, what's the risk?
Oh. Once you administer a vaccine that has been exposed to high temperature for a long time, the potency of the vaccine is destroyed. So you may take it, it will not do you anything, but it will not protect you against getting the disease. So you are just injecting yourself with water, and then it will not have any effect on you. So that's why we are insisting. As I speak right now, we have vaccines in our national cold room in Kolebu, for which districts, regions are mandated to come for the vaccine from there and use the existing cold chain system and distribute the vaccine to the patient.
So, I thought I was going to skip this.
No, I have to
but I've just been reminded, that I'm just looking at the piece of paper, that you are National Viral Hepatitis Control Program Manager. So are you happy about this policy?
Very happy. I led and ensured that this policy was implemented. Though it was saying that it was supported by private. We have public-private partnership. In the policy, it clearly stated that we collaborate with civil society organizations and non-governmental organizations, because you can't do everything alone. So it's partnership.
So what part did they exactly play? And what's their benefits? Because private people don't do things for free.
Before you enter into any partnership, you sign a memorandum of an understanding. And in that memorandum understanding, you make sure that there's no conflict of interest. Because I will not sign that when you bring this, this will be your benefit. No, that